Hi guys, welcome back to my YouTube channel. If you're visiting my channel for the first time, hi, I'm Dr. Jemi Anita. I'm a foreign medical graduate from Georgia. I cracked my June 2021 FMGE and waiting for my internship now. I had already made a 4-month study plan for FMGE. Guys who watched that and started studying, kindly stick to it. This video is for people who did not start their preparations yet and are confused about how to kickstart it. I'm here to guide you with a 3-month study plan. I'm just gonna give you an outline of how your preparation should be scheduled, and of course you can modify it according to your convenience. Few of you might wonder if it's really possible to study for just 3 months and pass FMGE. My answer to you is better late than never. You're going to put in all your hard work for these 3 months and you're going to give it a try. So let's get started with the video. Alright, the exam is on December 4th, so we have around 3 months left for the exam. So we are going to study for around 2 months and have the November month only for revisions. For people who watch this video late, if you're coming across this video in October, try to complete everything in 2 months and try to do your revisions then and there and give your best in the exam. So guys, we just have limited time in our hands, so the target is to cover as much as possible and to study as much as possible within this limited time. Study for at least 12 hours per day. You can always extend it. If you can do it for 16 hours, great, you can go ahead, but it must be at least 12 hours. So divide your study time into sessions of 3 hours each. So if you're studying for 12 hours per day, just make it 3 hours and 3 sessions. So in the first session of 3 hours, you'll study for around 15 minutes and then take a break of 10 minutes and then do it thrice. Or if you can't pull off 15 minutes, you can do it like 25 minutes and then take a break of 5 minutes. And the most important thing is to study everything from rapid revision. We don't have much time left in our hands, so it's nearly impossible to study everything from the detailed videos. So study everything from rapid revision if you are a PrepLadder user, and for others you can refer the important topics only. So we have limited time in our hands, so we just have 3 months, so it's impossible to cover everything from the detailed videos. Please don't commit that mistake. Go with rapid revisions. And one more thing, use printed notes. You cannot sit and take handwritten notes for each and every subject now, so go with printed notes. And for PrepLadder users, many of you are not aware of this. Under the rapid revisions video lecture section, you can find the rapid revision notes also attached, so go with them. So here is the schedule. You can give 3 days for anatomy, 2 days for physiology, and in physiology cover all the graphs and figures. So there were so many questions in physiology from diagrams this time in June 2021 FMGE. And give 2 days for biochemistry, go with clinically oriented concepts only, and give 5 days for pathology, focus more on hematology and general path. Give 4 days for pharmacology, 4 days for microbiology, 2 days for forensic medicine. It's very easy, you can complete it in 2 days. 5 days for Obs-Gyn, 7 days for PSM, 7 days for surgery, 5 days for medicine, 2 days for ENT, 3 days for Ophtha, 2 days for Ortho, 2 days for Pediatrics, 1 day each for the short subjects like psychiatry, anesthesia, derma and radiology. Pay more attention to radiology because there were so many questions from radiology. I'm repeating the same thing again and again. If you're not able to find the right option from the case that is given, you can just look at the radiograph image and you can come to a conclusion. So pay more attention to radiology, it's very, very important. Of course, everything is important. It's always better to study everything, but if I have to list out the most important subjects, I would say go with Obs-Gynae, PSM, surgery, patho, pharma, ENT, ophthalmology and radiology. This list is based on the patterns of previous year's question papers and also the subjects which were given more weightage in June 2021 FMGE. And that's it. You're going to study for 2 months. everything from rapid revision, or you're going to do the important topics, and then you're going to revise for 1 month. The November month is only for revision. You're going to revise everything you have studied before. While revising, my advice is to integrate the subjects. That way you'll be able to grasp the clinically oriented concepts well, and also you won't get bored, because if you study the same subject the whole day, it's normal to get bored. So go with integration of subjects. So here are few important things that you should keep in mind while preparing for the exam. The first point is to solve at least 100 MCQs every day. The aim of solving MCQs is not just the right answer, but to revise everything and to learn from your mistakes. So focus on the discussion part more. Secondly, try to look at the images every day before going to bed, and try to consolidate everything you have learned that is related to the image. And also focus on the COVID related things, because in June 2021 FMG there were around 3 to 4 questions from COVID. So try to focus on things like mucormycosis, the complications, and also the diagnostic methods more. And the most important thing is to revise, revise, and revise. It's okay if you can't complete all the 19 subjects thoroughly. It's absolutely okay, because even the toppers wouldn't be able to do that. So my advice is to revise the things that you have learned already, and to go to the next subject only when you're feeling confident about the previous subject. It's better to study around 12 to 15 subjects deeply and have an idea about all the other subjects. And also try to cut down the time that you spend on social media or anything else for that matter, which can drain your energy and time. Finally, eat healthy. Try to exercise every day, at least for around 10 to 15 minutes. Stay hydrated, stay safe, and have enough sleep. It's very important that you have at least 6 hours of sleep every day to function properly and to consolidate your memory. That's it, guys. All the very best, and have a positive approach towards the exam. If you work hard for these 3 months really well and focus on FMG and nothing else, I'm sure you can crack it. If you have any queries or doubts regarding FMG, feel free to leave it in the comment section below. I'll be always happy to help you guys, and I'll try to reply each and every one of you. Also, subscribe to my channel for more such videos. Bye guys, happy studying.